What is the hygiene hypothesis and lupus link? The hygiene hypothesis is a scientific idea suggesting that a lack of early exposure to microbes and infections might influence the development of autoimmune diseases like lupus. It proposes that when children grow up in overly clean environments, their immune systems may not learn to distinguish between harmless substances and real threats. This could lead to an immune system that overreacts, attacking the body's own tissues, which is what happens in autoimmune diseases such as lupus. Lupus is a complex autoimmune condition where the immune system mistakenly targets the body's own cells and organs. It can affect many parts of the body, including the skin, joints, kidneys, heart, lungs, brain, and blood cells. Symptoms can vary widely and may come and go in flare-ups. Common signs include fatigue, joint pain, a butterfly-shaped rash across the cheeks and nose, fever, hair loss, mouth sores, chest pain, and cognitive issues. Because symptoms are so diverse and can resemble other illnesses, diagnosing lupus can be challenging and often takes time. Research has explored whether environmental factors, including microbial exposure, influence lupus development. The hygiene hypothesis suggests that reduced exposure to microbes in early childhood might impair immune regulation, potentially increasing the risk of autoimmune diseases like lupus. Some studies indicate that children raised in very clean environments or with less exposure to infections might have a higher likelihood of developing autoimmune conditions later in life. However, this area of research is still evolving, and scientists continue to investigate how environmental triggers contribute to lupus. It's important to note that lupus is influenced by a combination of genetic, environmental, and hormonal factors. While environmental triggers like infections or exposure to sunlight can activate the disease in susceptible individuals, the exact role of hygiene and microbial exposure remains under study. Currently, there is no conclusive evidence that improving hygiene or increasing microbial exposure can prevent lupus. Understanding lupus involves recognizing that it is a multifaceted disease with many potential causes. Maintaining a balanced environment and practicing good hygiene are essential for overall health but are not proven methods to prevent lupus. If you suspect you have lupus or are concerned about risk factors, it is crucial to consult healthcare professionals who can provide personalized advice and appropriate testing. Ongoing research continues to shed light on how environmental factors influence autoimmune diseases, offering hope for better prevention and treatment strategies in the future.